So this webinar is being recorded and will be made available after the fact. And as you all know, we upload it to YouTube, and then I'll send out a link to the recording, and it's posted on our website. And so this will be made available if you want to rewatch or share it with any colleagues who weren't able to join us this afternoon. And during the presentations this afternoon, please feel free to use the Q&A function to submit any questions. Because we do have two presenters this afternoon, feel free to add questions, and then we'll stop in the middle for a Q&A break related to the first presentation, and then we'll continue with the second presentation, and then we'll have more time at the end for additional questions and discussion. We are scheduled for an hour and a half today, and I imagine that there will be ample time to just kind of talk shop and really explore what ideas you might have for equity work in your locations, in your states, and what you can do to better serve maternal and child health populations. The chat right now is disabled just to minimize the chatter. That way we can focus on the presentations for this afternoon. But at the end, I will open it back up. And so that way we can chat with each other and really have a lively discussion. But yes, so like I had mentioned, please make use of the Q&A function, and I will be keeping an eye on it throughout the entire presentation. So our first speaker is Ms. Rose Anderson Rice. She is from St. Louis, Missouri. She serves as the Deputy Director with Generate Health St. Louis, whose mission is to advance racial equity in pregnancy outcomes, family well-being, and community health. As Deputy Director, Rose is responsible for leading and managing a comprehensive array of collaborative initiatives and community engagement efforts. She holds a Master of Science in Public Administration and Policy Analysis and a BS in Elementary Education. She is an engaging leader with experience working to improve conditions affecting the quality of life of moms, babies, and family units in the St. Louis region. For over 25 years, she has strategically worked in the nonprofit sector, which brings with it unique opportunities and challenges. Rose is passionate about equitable access to resources that ensure children and their families can thrive in life. Rosen is an experienced trainer and facilitator and engages the community using a strengths-based approach. She serves as a part-time adjunct faculty with St. Louis Community College in Florissant Valley. And Ms. Rose, I'm going to stop sharing my screen, and feel free to share yours, and we'll get started with your presentation.
Technology, you have to love it, right? All right, let me find my presentation. That would be great. Can you see it?
Yes, ma'am, we see your PowerPoint.
Okay, hopefully. Oh, and that's not the right version, is it?
At the top there, you can, yep.
Here?
Yep, switch display settings. And swap.
There we go.
There you go.
Awesome.
Thank you.
Awesome. Yay, it worked. Greetings. I bring you greetings from the steamy hot St. Louis, Missouri. The sun is shining, so we're excited about that. No torrential rain, which we have been experiencing, but it is definitely hot here. I will just reiterate a little bit in my bio. You heard about the mission of our organization. Generate Health is a community-based organization. We've been around for a little over 22 years. And our mission really is to mobilize and inspire our region, really want them to advance racial equity in pregnancy outcomes, family well-being, and community health. And our organization made a commitment to specifically focus in on the Black community because the disparities in infant mortality and maternal health are so desperate and wide. And so there are other organizations who are addressing racial equity in our region, but we're specifically focusing in on advancing racial equity in the Black community. And that brings us to a unique initiative that we have here in St. Louis, which is called Flourish St. Louis. And Flourish St. Louis brings community members who are impacted. A lot of times folks say community And when they say community in our region, they mean community-based organizations and other folks who work for organizations. When we say community, we mean folks who have lived experience. The folks who sit on our Flourish cabinet, I'll talk about that in a little bit, have lived experience. They either had a baby born too soon, born too small, or die before its first birthday. And that's who we mean when we say community, lived experience impacted by these racial inequities. We bring them together with key stakeholders like healthcare and other nonprofit, business, and academia in our community. And together we work to reduce infant mortality and to change how the systems are working in St. Louis for Black families. Our initiative has a North Star. Our organization has a North Star, and our organization's North Star is zero racial disparities in infant mortality, period. And Flourish has added the caveat that they want zero racial disparities in infant mortality by 2033. And this is in alignment with Forward Through Ferguson, which is an organization in St. Louis. I'm sure you've heard of the killing of Mike Brown, and that happened in Ferguson back in 2014. And out of that Ferguson Commission, Forward Through Ferguson's the organization that was birthed. And they have a challenge to St. Louis to become more equitable by 2039. And so we feel like if we can't determine whether Black babies are dying at the rate faster than white babies, if we can't determine that by race, then we're well on our way. By 2033, we're well on our way to a more equitable St. Louis. So that's how this aligns with that goal. I was talking about Flourish specifically because there's such a centering of community in that initiative. And all of our initiatives have community centering community, but this is our staple initiative that really highlights because of the way we have embedded and engaged in community to lead this initiative. Flourish is led by a community leaders cabinet. Again, these are folks who have lived experience. They give and provide the strategic direction for Flourish. They identify barriers to racial equity, potential solutions from direct experience and engaging the broader community. And this represents 3 of the 25 who currently sit on the community leaders cabinet. They were nominated, and they come from the highest zip codes that are impacted by infant mortality and maternal health. And so we just love to be able to elevate their voices anytime we have an opportunity to share. The first person just said, I believe engaging parents and community members can make a big impact in improving conditions for Black families. This is why this is their vision for Flourish. Second community leader, I am proud that we've established ourselves as a voice in the community, an organization that stands up for those who can't. And finally, I want a future where all systems changes on behalf of our children. Education, jobs, healthcare, welfare, policy, all policing, all of the systems are working well for families. Love this picture so much because I'm a little partial to this group as well. So Flourish has that leadership cabinet that I was just talking about. We also have several moving parts. That's part of Flourish, helping to reduce infant mortality in our region. What the group that you're seeing on the screen now represent a particular community group, which was organized and pulled together when we became one of the cohorts for CityMatCH's Institute for Equity and Birth Outcomes. And our particular our group was called Flourish More, which is an acronym, Motivated Outreach for the Restoration of Equity. And the community group, the community members who came to that table and who continue to come to that table today, this was years ago, I want to say 2016, 2017, when we first started. We still meet every month. And this group created that name on their own. I was just astonished. In less than 10 minutes, they were like, motivated outreach for the restoration of equity, flourish more. And I was like, yes, I love it. It is. You said it. It is. Flourish more. We have community meetings and really talking about how we engage community. We have in St. Louis 2 health departments. We have a city health department and we have a county health department. And Generate Health sits kind of in the middle. We're partners with both. And a part of, the CityMatCH's equity, improving equity and birth outcomes was you had to authentically engage community. And so sometimes the health department, that's not the best, place where that to live. And so our health departments, saw that as a strength that Generate Health brings to the partnership. And so, yes, we were able to talk to folks about what we wanted to do and bring them to the table. And we do have some community partners who are providers who also sit at that table, but we've been very, very cautious and careful about the balance. We don't want to have too many providers sitting at that table because the community voice is more important to us, together. So we want to make sure that they feel comfortable in numbers as well as in power. What you're seeing here was our exercise we were going through to try to decide, based on data that we received, what do we want to do? And I'll talk a little bit more about that in a moment. It's very important for us to honor the time that community members put into elevating their voice, finding solutions, implementing solutions. And so we try to eliminate as many barriers as we can. So we provide stipends, not a $10 gift card, because a $10 gift card doesn't do much, right? But we have a scale based on the level of engagement. Flourish More's community leaders get $25 every time we meet. That's their stipend amount. Our community leaders cabinet get $50 every meeting because it's more governance, way more governance, and they're governing the whole initiative. And then we also take care of transportation. If folks have their own transportation, then we give $10 gift cards for gas. If they don't have transportation, we schedule lifts to pick them up. And of course, this was all pre-pandemic. Because right now we're all meeting virtually. We're all still meeting, but we're all meeting virtually. And then we would take care of childcare, whether that was, we provided the childcare, working in partnership with childcare companies in St. Louis, or if they had someone who could watch their child, we would pay a stipend to that person. And then we used to always have food, of course. Now with, the way we're implementing this during the pandemic, we made sure that everyone had access to technology, whether they were using their phones or tablets. And then the stipend was increased since we don't have childcare, we don't have transportation, we don't have food, to help cover the cost of cell phone bills and internet, right? Because you got to use your internet to be able to really engage as well. So everything, we also, at the very beginning of the pandemic, had all of our community members who participated in our initiative sign up for, if they already had bank accounts, then we did direct deposit for the stipends and the cell phone internet stipend to their bank accounts. And if they didn't, we had them sign up for Chime, and then we would put that directly on the card so that they had access to it. So again, paperless. Just during the height of the pandemic, we didn't want to be face-to-face or be giving out money, but we wanted to make sure we were acknowledging their time. We get paid for our time. We can't pay them for their time, but we can at least give a real stipend. A $10 stipend doesn't do a lot. And sometimes bus tickets don't do a lot either, because the barrier of trying to get on the bus, and it's just a lot. So that's why we send lifts to their home, pick them up, bring them to the community meeting, wherever it is. And usually our meetings are not in our office. Our meetings are within the zip codes with the highest infant mortality rate. So they don't have far to go. Data is really important, and this was a meeting where we were actually talking about data. We also, with our institute, our Equity Institute partnership, had access to 2 epidemiologists at St. Louis County Health Department, and we have 2 epidemiologists on our team as well, and also a professor, Dr. Pam Exaverius. She's always at the CityMatCH conferences presenting, help to talk about the data in our community, to help share and elevate. Community knows that there are things that aren't working well. Sometimes when they see the numbers and you break it down in a way that it's digestible, it catapults them into action. And that's exactly what happened. It was like, we have to do something now. Babies are dying now. And so just was excited about how this was playing out in our group. Our Flourish More decided to focus in on housing because Flourish, our umbrella initiative, was already tackling safe sleep, was already looking at prenatal care, was already looking at transportation, and navigating health systems. And so where we saw there was impacts on mom's health was the housing space and the lack of quality housing in our community. And it had desperate outcomes on respiratory health of the babies and the children in those homes. And so we decided we would focus in on housing. And specifically, one of our community leaders at a community leaders cabinet meeting was, there was a presentation about safe sleep and the strategies they were going to put into place. And the community leader, who happened to be the president of the Tenants Association board in one of our housing complex, kind of raised his hand and said, that's all well and good, completely agree that babies should sleep by themselves in cribs or in a portable crib. But in our community, the moms are sleeping with their babies because we have a mice infestation. And so they're hitting the mice off of their babies during the night. And when he shared that, it stopped right there, and folks are like, okay, we have to do something in this community. And that really then focused Flourish More work, because we were going to do something in housing already to specifically work in that particular housing complex. This is a slide that tells you a little bit about some of the work we've done. These are pictures actually from last October. We held a what we called an essential care package outreach. Specifically, we gave out bags, loaded down bags to the residents in this is like the community center in that complex. And we gave them hand sanitizer and masks and laundry detergent. And we also came up with, and I'll talk a little bit more about this too, this bottom bullet talks about how we collaborated, and it says the EHOC, we call it EHOC, so it's Equal Housing Opportunity Council. We collaborated with them to design and develop a tenants' rights one-pager, and I'll talk a little bit more about that in just a second. So that was in this giveaway bag. We had snacks and food, and then we had backpacks for school supplies that they could have. And some of our partners, what these beautiful children are holding are tablets that were loaded down with educational games, and it has Wi-Fi already installed in it. We gave those away. We had 25 to 30 just giveaway packages, which could have been gift cards or $50 gift cards. It was an amazing event. We also brought like all kinds of resources at that time because it was October. It was free COVID testing. It was we'll sign you up for Medicaid if you're not signed up yet. And if you need legal services, here's a resource here. And so all around that parking lot, we were outside, socially distanced, providing resources to that particular community. Flourish More has also given input into the development of a public service announcement that the St. Louis County Health Department was creating. We hosted a meet and greet in that community to say, here, we're Flourish More here, and we're here to hear what's going on with you in your community and we want to help improve conditions. And then also just we have a collaboration with the Housing Authority, because the Housing Authority actually owns this housing complex. But before we got there, the mice infestation was awful, absolutely awful. And so it was Flourishmore folks, but then it was others on our team who galvanized residents in this community to elevate their voices to legislators, to their alder people in that community. We brought the news in, who were also talking to residents and going in their homes to show, where mice were, and they had bed bugs and just roaches. It was just horrendous. And the sad part was that people had no way of getting out of there. They have a voucher program, but there were no places to send them in St. Louis because the housing stock is so awful. So the city health department, who is also our partner, we pressured them because they're the ones that go out and actually do the housing inspections. And so they would do the housing inspection, and then that information was shared with the Housing Authority, who then had to go into mediation with an exterminator for over 6 months to try to remedy this situation in community. Also found out that the Board of Commissions, which is who the head of the Housing Authority reported to, not the mayor, they had no clue, because according to them, everything looked good. So a colleague of mine mobilized residents in Clinton Peabody to be able to go to the Board of Commissions meetings, which was a whole nother barrier. Like, you have to get on the agenda so many days ahead. So just lots of things that make it hard for community members who have real lives to be able to engage. But we try to eliminate as many of those barriers and help them navigate through them. And so they were able to elevate their voices and share without fear of repercussion, that the conditions we're living in are horrible, and something needs to be done about it. We're still working in Clinton Peabody community. We've partnered with St. Louis University, and right now we're waiting on IRB approval. But we're going to host Mommy and Me cafes in the community, and that'll be for pregnant and parenting people who have children 5 and under. And we're going to bring resources and really want to be able to focus in on mental and behavioral health. But what we want are healthy babies and healthy moms. And so the cafes that we're going to be setting up are going to be things that help get us to that end. So we're super excited. The work is still going. The people who were engaged in 2014, 2016 are still engaged in 2021. And they're still, they never cease to amaze me. We may think we haven't figured out. We come in sometimes, this is what we're going to talk about today. And immediately they're able to say, no, here's what's going on in community. That's not going to work. You need to change this language. I understand that sounds too high level. You need more photos. This needs to be more of an infographic. Like, they give us that kind of feedback and pushback. It's definitely not us leading the initiative or the work. It is those folks who are most impacted who get the opportunity to do it. And then there's some, lessons learned that I'd like to share. Just one, progress moves at the speed of trust, and authentic engagement is needed to achieve that trust. And so if you're like, I got to do this project in 6 months, and that's not how community is moving, then you have to be able to be nimble, adaptable, to move as the trust builds. We've built a lot of trust, we being Generate Health. Our community leaders talk to others in the community, and a lot of folks want to get involved because they know that their voices are going to be heard. It's not, we checked the box, we had 5 community people show up and the rest providers, and no, we had community representation. We try our best not to do that or tokenize their voices either. We recognize that the power of community, they have the power to make change. They know what they want to see. They know what they hope to have. And they just need somebody to listen to them and give them a platform to elevate their voices so that those kinds of changes can be made. Community-based organizations, I think our partners at the health department have said this over and over, that they enjoy partnering with us. It's easy to partner with us because there is this flexibility with Generate Health being, you know, a community-based organization, that we can advocate for policy changes. We can advocate for community changes. Our whole stipend process, we're in a grant relationship with St. Louis University, and the bureaucracy of the university to pay out stipends would keep it tangled up for a whole year. So that's why we get that funding to then, they subcontract with us to then implement that, because it's simpler coming from our organization than them trying to offer that up. I had already kind of talked about remaining flexible with, you know, changing of strategies, changing of implementation. This made sense. We all should know this by now, right? We all had our plans for 2020 and then COVID hit. Guess what? We had to be changed, you know, flexible in changing those strategies and those implementation plans because you couldn't do it in a pandemic. So, you know, I think there are some lessons we had to learn in 2020 that we should take forward. No one has it all figured out. Like, there's no right way to do community engagement other than be authentic, you know, and meet community where they are. What works in one community may not work in another community. You know, we have to identify some champions who can vouch for you. If you don't have that trust, you don't have that reputation, who has it in community? And can you partner with that person? Has that person had enough interaction with you that they can say, no, these are the good guys, or, you know, or they really do care about babies and families. Our moms and our babies, they need you now. I think this sense of urgency to change community conditions is huge for us too. Like, we are kind of building the plane as we're flying it. There are some goals, some benchmarks. We have a logic model, all of that good stuff, but we can't wait for all the things to line up to be able to do the work. We just have to get in and do the work because the systems are not working well for families. In terms of our internal equity work, I was asked to share a few things that we've been able to do. We are currently in the process of a racial equity audit. Internally, we're working with Crossroads anti-racism organization, and they really take a look at institutional and systemic racism. And they ask you lots of really hard questions, like, you know, who are you really accountable to? Are you just accountable to your board? Are you accountable to politicians? Are you accountable to community? Does community know that you're accountable to them, and how? Right? So we're being asked some really challenging and taxing questions, all in the hopes. We've been in this process since March of last year, and we're almost to the point of being able to have recommendations to offer up to our staff, our board, our constituents, so that we can put together a plan, a racial equity plan of how our organization, we have a goal of being more anti-racist and anti-bias. And so this racial equity plan is going to help us become more anti-racist, anti-bias. That's our goal, long-term goal. In May of 2020, when George Floyd was murdered, a lot was going on. There was high tension. Everybody could feel it. And our executive director was sensitive enough to say to our staff, specifically to staff who identify Black, that she gave us a self-care day. Take time. If you need us to pick up work, let us know, you know, but take a day to do whatever you want to. If you don't want to watch this stuff anymore, if you just want to be engaged in what's happening on TV, or you want to go out in March, or whatever you want to do, use this day. And it's not part of your, you know, paid time off or anything else. It's a self-care day. Take care of yourself. And that was huge to our team. Just said a lot about how she cares about us. And then this year in April, same thing, you know, she was going to offer another self-care day for Black staff, those who identified Black. And, you know, I was like, why don't we close the agency and have this be a day of unity for our whole team? So everybody got that day off. Again, not part of your paid time off, no expectations. We just had a message that went out to our partners or whoever was emailing us to say we were taking this day to take this time for ourselves. We do our work using a racial equity lens. We ask ourselves questions, you know, who's going to benefit more from this? Who's going to be disadvantaged from this intervention or this solution? How are we oppressing or further doing harm to people of color? And we're looking at that at our interventions and with solutions. And then I don't do this work, which is fabulous because I have a wonderful team, but our epidemiologist really is working with equity indicators that were adopted by Ford v. Ferguson, and they have calls to action for the community. And we're kind of grading ourselves and holding ourselves accountable against those calls of action. And then funding, again, if you're really doing racial equity work or equity work, where's the funding that shows that that's what you're doing, right? I'd already talked a lot about how we try to eliminate as many barriers to participation for our community members. We also put a lot of funding into training for staff, training for board. We realize you're not going to train your way out of, you know, what's happening in racial equity space. You're not. So how do we then how do we have this continuum, a plan of we're doing this training, how are we assessing ourselves? How are we holding ourselves accountable? How are we taking care of ourselves, the community, like really making this full circle? And then how are you putting your money in that? Yeah, put your money where your mouth is, kind of thing. I always get asked questions about, you know, the t-shirt. They are for sale if you're interested. I'll drop in the chat after our next presenter the link to get there. And I'll also drop in the chat the link for Crossroads if anybody's interested in engaging with them to do a racial equity audit in your organization. And I love this picture because we have our wonderful folks from CityMatCH who came down to visit. These are people who were part of and are part of Flourish More. And that's all I have. Here's my contact information. If you have any additional questions that don't get asked today, or if you need additional resources. Yeah.
Thank you so much, Ms. Rose. We always really appreciate hearing about your experience in St. Louis, working in and with community and improving the maternal and child health outcomes for St. Louis. And I just really wanted to highlight some things that you had mentioned that really stood out to me. It's first, the authenticity in community engagement is key. So at CityMatCH, we often tell the teams, like, that's the most important work that you'll ever do, because that is where you make the change. That is how you become most effective at your jobs, right? And so you had talked about having meetings in zip codes with the highest needs or facing the disparities in your community, sending people lifts instead of bus tickets. Because I've heard some people talk about, you know, I've got tons of bus tickets that I can't give away. I can't beg people to take my bus tickets. And that's very real, because bus systems may not be, you know, reliable. They might not be on time. They might not come, and that sort of thing. And so I think your idea of sending lifts is just so impactful, and it removes such a massive barrier for a lot of people. So it's really great that you're able to do that. And then, you know, your point about like getting on agendas for like official bureaucratic meetings and all of those things too. And that comes into me, that like brings into question having meetings at like City Hall or downtown, where you have to get there, pay for parking, find your way into the building, go through security, and like all of these little things that just make everything so inaccessible for the public. And so I really appreciated you bringing those points up. And then about your point about internal training and holding yourself accountable, everybody talks about training, right? There's so many trainings. You can attend this, attend that, and do all of these things. But at the end of the day, how are you holding yourselves accountable to that information? And ultimately, how are you using that information to impact maternal and child health outcomes? Right. So I really, really appreciated you bringing that up. And while you were presenting, we did have a few questions that came through the Q&A. Let me pause and turn on the chat. Okay, so for the audience, I had just turned the chat function back on. So in case you wanted to add any comments or any additional questions in the chat or in the Q&A, you're able to do so now. But in the meantime, Ms. Rose, we had a couple questions about how you fund this work, specifically payment to the mothers for participation, childcare, transportation, and that sort of thing.
It's grant funded. Our organization is like 95% grant funded. And we're like working hard to diversify our funding stream, but every grant we write for, we always write those staple services in it because we feel like centering community is so important, so vital to our work that we can't do our work without those funds. And so we always think about how many meetings, how many community members. So it's not like come one, come all, because we don't have an unlimited budget, but we do try to make sure that we put all of those costs into every grant we write. Yeah, so it's grant funded.
Yeah, and that takes a lot of intentionality behind prioritizing the community, right? And then we received a question that says, can you reshare the name of the organization and or tools that are being used to conduct the racial equity audit?
Yes, I will put their link in the chat.
Okay. And then we also received a request to put your contact information back up, your slide with your contact information.
I could stick that in the chat as well, and then
okay,
you can just copy and paste it. Yep.
Yeah, that's perfectly fine. Thank you. So we have quite a bit of time scheduled for today. So if there are any other questions for Ms. Rose, feel free to enter them in the chat or in the Q&A.
service. Our organization is an intermediary organization. We're considered a coalition. We're a coalition of about 300 organizations. And so we just sent those out to the federally qualified health centers who have families in these zip codes, that they're servicing. We put it in, the library. And so we were targeting the zip codes with the highest infant mortality rates. And then those folks would fill out that application, telling us a little bit about their story, why they wanted to be on the cabinet. And then we had a community review committee who looked through those and chose the cabinet. We're actually on our second cohort of cabinet members. So our first cohort served for 18 months, and now they're moving into a role that we're calling Flourish Champions. And then we just recruited another 30 community leaders, completely different, and they're now leading the Flourish work moving forward.
All right, thank you, Ms. Rose. We do have a couple of other questions, but I am going to pause right there, and we're going to move on to Ms. Dannai's presentation. So everyone, our second presenter for this afternoon, Ms. Dannai Wilson. She is the program manager of the Maternal and Child Health at Allegheny County Health Department. She has served in Southwestern Pennsylvania in the areas of business, social services, public health for nearly 25 years, with the last 11 years with the health department focusing on initiatives designed to improve health and well-being and eliminate racial disparities in mortality. Some of those initiatives are evidence-based home visiting programs, including NFP, or Nurse Family Partnership, and Healthy Families America. Her department also exists to end racial disparities and uphold equity for all through effective collaboration with community members and organizations. Her team convenes multiple groups around breastfeeding, home visiting, infant mortality to ensure public is involved at every stage of the process. So do you hear a common theme coming through in our webinar today? She was recently appointed to the Governor's Maternal Mortality Review Committee and serves on the board of directors for Just Harvest, Healthy Start, Inc., the Children's Cabinet, Footbridge for Families, Black Women's Policy Agenda, and Southwest Area Health Education Center. She dedicates her time to other advisory committees and is a Carlow University alumna. She received a bachelor's degree in communications and a master's degree in organizational leadership. She's a Pittsburgh native, a military wife, mother, and grandmother. She often imagines a Pittsburgh where all residents experience and benefit from what this great city has to offer. And so, Ms. Dannai, with that, thank you for joining us this afternoon, and I will pass it to you to begin your presentation.
So I hope everyone's able to see my slide. It should be my equity framework here. Welcome, I'm excited to be here and talk with you all about the equity framework that we've been using since about 2017. And so if you're—
Can you zoom in a little bit on that?
Zoom in.
Yeah.
That's too much.
No, that's good, actually, if that works for you.
Okay. I can make it a little smaller, I think. Okay. Thank you for letting me know that it was too small for everyone. So what I'm going to talk about today is what we've been doing at the Allegheny County Health Department. We're very fortunate to have just joined the CityMatCH community just a few years ago. So I'll talk about that project as well as we move through my equity conversation with you today. So one of the things that I think about is, the role that we play in government and how we will really endeavor to do this work. And so recognizing the seat that I sit in, all of this information, I just want to put into that context. This particular model that I'm going to talk about, we actually learned from the New York City Health Department back in 2017 in their Center for Health Equity. So this idea of using these 4 buckets to kind of think about your work if you're going to be thinking about equity work is focusing on these 4 categories: internal reform, community engagement, neighborhood investment, and data. Our quantitative and qualitative data, which all of these things were covered in Rhodes' presentation just a few minutes ago. And it's just the way in which we incorporated it so we can measure our outcomes throughout our time. And so one of the things I think about is how we often think about frameworks, how we use them, how we incorporate these into our work. We were introduced to Dr. Vijaya Hogan in 2016. She came to the city of Pittsburgh and met with some of our health department leadership to talk about what does it mean to have health equity? What does it mean to name race in our discussions so that we're being intentional about the work. And she introduced to us a framework called R4P and the Rhyme scale. R4P framework focuses on the categories that it's an acronym for repair, restructure, remediate, remove, and provide. And the Rhyme scale is a 12-point bidirectional scale designed alongside the R4P, and it measures the extent to which an institution is in the process of racial equity changes. So on this scale, the least desirable score is a -6, which states that the organization's efforts influence other entities and community to embrace regressive actions, creating momentum away from equity. The most desirable score is a +6, which states that the organization's efforts are firmly institutionalized and influence or work with other entities and communities towards equity. After doing some of this work, we actually did an assessment in 2019, and we found that we're currently at a score of 3. So what does 3 mean? 3 means that our actions to address equity are considered an integral aspect of the institutional or programmatic goals and objectives. The institution provides active and continuing support toward increased efforts. So that's where we are today, and I'm going to tell you how we got here. So here's the steps that we took to get our score of 3. We're currently in the process of being evaluated again, but I just want to give you some backdrop to how we got to where we are today. Under internal reform, one of the first things we really did was to do our research and identify national experts that could come into our community and really give us some information about what's going on in equity, where's the research, what do we understand, because we already knew racial disparities were happening. We already understood the gaps in care. We've had a Healthy Start project. We were one of the first projects in 1991. Actually, Pennsylvania has the distinction of having 6 Healthy Start projects back in those days. So the problem of infant mortality, and particularly the disparity between Black babies and white babies was well documented. And so that was understood, but how to address it was less understood. And so the first presentation that we really focused on was from Dr. Kamar Jones. And she talked about naming racism and also, thinking about data differently. How do we use data? How is it interpreted? Who is presenting the data? And how are we coming up with the analysis? And so one of the things that we really took from that presentation is that, as a health department, we were great at bringing forth the data, making it visible, sharing it out to individuals and organizations. But how are we interpreting what the vital stats data was telling us, which really examined or focused on personal behaviors and less likely to focus on institutional or systemic challenges that organizations had, particularly around racism or mistreatment or maltreatment of individuals in their care. And so we had to really do a deeper dive of how do we find or get additional data sets to help us to also frame that narrative. And so that work, coupled with the understanding of the scale, we went back to our community partners. And so thank you, Rose, for talking about that, because I think in government, we tend to talk about community partners and it's loaded. and there's actual levels to community partners, because I do agree that some of our partners do include the community-based organizations that we partner with. It also includes the healthcare providers and institutions that we partner with. It also includes individuals who might be advocates or serving on advocate types of organizations. And then it also includes our community residents, and then those who have the lived experience are actually being impacted in the data set that we're actually reviewing. And so we did have start separating who we were talking about. And when we did surveys or when we were having meetings, we were very intentional about making sure we tried to figure out how to make sure we had enough representation for all of those levels of community input. So that when we were talking about community input, two things: we were intentional about who said what, because context and perspective matter. And then another layer of that was also making sure that we were getting input from every single one of those categories, because we all had an impact on the analysis of the data. So I definitely think that was an important step. But I think the most important step that we took along this journey, our equity journey, was joining the Government Alliance on Race and Equity in 2017, I'm sorry. And if you're not familiar, the Government Alliance on Race and Equity back in that day was 166 jurisdictions across the country. And so jurisdictions are any type of organization identifies as governmental. I mean, these are tax paying types of public service organizations throughout the country. It included libraries, public safety departments, civil rights commissions, city governments. There were very few health departments when we joined in 2017. But still exciting nonetheless. Each of these organizations, we got together into various work groups to talk about what are the challenges happening across the country and what is government's role in undoing racism in the ways in which we address our work. And so now we're still a member at this day and age, and there's about 350 governmental institutions. And now we actually have a public health working group that focuses specifically on what changes can we make in public health to advance racial equity. And so that's a very meaningful transition. And that's actually where we were introduced to this framework out of New York City health department that focused on these 4 bucket areas. And that really changed the trajectory of all of our work. And some of that work actually began with training our staff. That's an important step, because what we understand is we can't go out and do equity work if we haven't done some of that internal work and making sure we changed our lens in the ways in which we view the world and view the responses that we'll get from community. So, it kind of helps us to think about reducing any types of defensiveness against, blame, because this is not about blame. It's about how do we work collaboratively, listen to each other to actually start to institute changes that will make an impact on communities, and communities feel like they had a shared participation in those initiatives. And so that was the first step. So we did train our MCH staff at this point, and in our equity journey, this was not a full health department type of initiative. We only had trained our staff, which are our home visiting staff, which includes our public health nurses and other professionals in our department. And then also we trained other providers in our institutions, such as our HR department at that time, just leaders in other air quality. It just depended. It was optional for other providers across our system to really think about if they wanted to participate in the training. But it was critical because we were the program directly serving families that were impacted in the data. And so we did a lot of that training in the beginning to really just get our staff up to speed and help us to look at our work differently. And then we trained our community partners. As you can probably realize, some of these trainings are very expensive and also take up a lot of time. And so we also made sure that we scaled or leveled, I'll use taking Rose's term, the scholarshiping for organizations to provide. And I said there were different levels to our community providers, and we made sure for each level that you were in terms of in the community providers, that you had, in terms of the training, community residents could come absolutely free. If you were a community-based organization, you would have a discounted rate that you would pay to come to the trainings, and so on and so forth, until everybody had an affordable rate that made sense. We also offered continuing education units for organizations whom could use that to advance their continuing education in their degrees and certain things like that. So we made sure to also provide that to our stakeholders, because it was critical that we brought everybody with us when we were doing this work. It wasn't okay that just health department staff had this knowledge. We wanted to make sure that all of our partners, which we have about 300 partners that serve on various committees that we currently facilitate, we wanted to make sure that all of them had access to the information at the same time that we were growing. The other kind of thing that I think about as we think about this work is when we joined GARE, it also helped us to connect to other governmental agencies in our own region. Yes, we went all the way to a conference in Chicago to actually learn that our city department, mayor's office, our urban redevelopment authority, our office of probation, or some of our funders, our actual private funders, were all also members of GARE. We didn't know locally that all of us were really trying to learn this work and trying to make change in Allegheny County and in the city of Pittsburgh until we got to Chicago. And so it was the first time that all of us convened together and decided that we would come back to this region and really put forth a concerted effort to change all of our systems to be more thoughtful about how we engage this issue around racial equity, which led us all to start collaborating and talking about how we do it. And so one of those ways was changing hiring practices, the changing the ways in which we contract with small businesses and vendors in our community, making sure we take the extra effort to make sure that we include individuals in the opportunities that were available from the government. And then we also did internally, we shared we actually underwent a full equity audit to determine a baseline for where we would be in terms of preparedness for doing health equity work in our organization. That was an organization-wide assessment that also included not only a survey, but also focus groups at each level of the organization. And also they really, the organization we worked with really built up leaders from within to serve as health equity champions in the future. And so it was a very lengthy process. It took us about 6 months to go through. And actually some of the results and recommendations from our internal assessment actually ended up in our strategic plan. And so some of those things, like I mentioned, included, changing some of our hiring practices to ensure that we can get as many applicants in the door as possible. We are a civil service organization, and so we're governed under the Civil Service Act. So just making sure that we weren't creating positions and keeping people with less experience or degrees from being able to be employed with the health department. And so that was a really big change because either you had to have really high education or you had to have a whole lot of years of experience, which, is hard to find and leaves you with very limited options in terms of the type of individuals you can employ. Most recently, we were able to hire a health equity coordinator that really would help us think about how to institutionalize a lot of the strategic planning efforts, a lot of the recommendations from that assessment, and really help individual programs and departments within the health department implement their own health equity plan for their area that they work in. So that's kind of where we are in terms of internal reform. And so that's ongoing. Our health equity initiatives and a lot of our work, we're fortunate to have a public health information fund. And that public health fund is basically a collaboration of our local funders that have a board that if the health department submits applications to them that would be meaningful and would change kind of the scope of population health in our region, those types of things can be submitted to them for funding. And so that's how we were able to hire the health equity coordinator. And that's also how we were able to do our organizational equity assessment. In terms of community engagement, some of the philosophies that you see here are also, I want to just acknowledge that we got a lot of this content from other people. And so the themes in each of the buckets came out of the community engagement framework created by our colleagues out of Texas in Joyce James LLC. She also was involved in doing a lot of the training with our MCH staff in the beginning, in the early years of our training. And her training focuses on disproportionality in the child welfare system, but how she framed the training is to also understand that that happens in every system. So disproportionality is happening in the education system, it's happening in the healthcare system, it's happening in every system that we're participating in as families and communities. And so some of that work is how do you engage community? And they focused on a structure, right? You have to have accountability. You have to build leaders from within your community. How do you engage them? And I think Rose did a great job of explaining about the leadership process. And we do some of that work here, but it's through partnerships with our local nonprofits or organizations such as Healthy Start, who actually have years of history of really doing a great job of engaging community partners already. So we don't have to create new opportunities to try to engage community, particularly if you're sitting in an organization or governmental agency when there's history of distrust. Sometimes we gain that trust through allowing other organizations to lead. And that's a lot of the work that we've been doing, is really identifying partners that do the work well. And using some of our own funding to help support the work through them. And so some of that work looks like, just making sure that we made the problem visible. So we had a summit in 2018, and we brought in some national speakers and experts in the work, but we really highlighted our local organizations, like New Voices for Reproductive Justice, which we also found is another issue that we saw coming up in the data, is really understanding reproductive rights and where is the justice happening for Black women specifically, and how is that being framed in our community and in our work, and how does that intersect with all of the other challenges that we face with social determinants of health and so forth in your community. We also had a national presentation from a national journalist and speaker, Miriam Perez, who really helped us. She wrote a book. And so we made sure that every participant at our conference that year received the book, because we also were acknowledging at that time that doulas were important to the work. So every time that we learn something is important to this work and this journey that we're on, we wanted to make sure we elevated that we made that issue, whether it's something to affect the work, right? We know we need more doulas. We know that to make doulas accessible, we needed them to be well funded so that they could be made accessible to women. And then we also want to make sure that reproductive justice and intersectionality became terms that people understood and recognized and would also think about in their areas of work. And we also had Dr. Kamar Jones and Dr. Joy Creer-Perry from the National Birth Equity Initiative. All of these different voices, and particularly all of the individuals represented at our conference that year, were all women of color, because it was also important to us to highlight that experts come in many shades, and we needed to be elevating all of the experts who have voice and expertise in this particular work, including their research. And so that was a very important thing that kept coming up with our community partners, to really identify other people in the, that are doing the work that were also folks of color. And so that was really a big focus. But what we learned at the end of that conference is that, of course, it was at a hotel. Of course, it was well attended. We had lots of community providers and that attended, but we didn't have many community residents. And so we had to revamp the conference the following year. So this is taking community feedback and actually using it. We went to all some of the communities with the highest rates of infant mortality the second year. And we actually, a conference was shifted to focus on the social influencers and birth workers in the community. So doulas were leading presentations, our reproductive grassroots leaders were leading presentations and focused on birth justice. And we really, took that narrative that we had before, which was focusing on the problem and the data to say, here's the solutions. Here's where you can find solutions in your community. These are the individuals that are leading that work, and this is how you can connect. And so we found we received a lot more community representation, and that's how we recruited community members to our coalitions moving forward. We had gained their trust. We had given them good information. We gave them a lot of resources. And so I think that was an important distinction, is that how do we make events and things that we did really more inviting for community members to want to attend. And so out of the most important, I guess, our thing that kind of shifted our work is in 2019, the University of Pittsburgh released Pittsburgh's Inequality Across Gender and Race report. So this made national news. So I don't know if everybody on this call is familiar, but I definitely have the link so you can read the article yourself. But it really highlighted some stark disparities across gender and race in the city of Pittsburgh. And it's one of Allegheny County's 130 municipalities. The city of Pittsburgh is our biggest city, home to lots of sports, the Pittsburgh Steelers and, you know, the Pittsburgh Pirates and all those types of things. It's also been voted most livable city, and all these types of accolades were given to our city. But at the same time, there was an article written about the report that identified that Pittsburgh is the worst place for Black women to live, and for just about every indicator of livability. That's an actual quote from the Gender Equity Commission that we have here in Pittsburgh. And then there was another quote. What this means is that if Black residents got up today and left and moved to the majority of any other cities in the US, automatically by just moving, their life expectancy would go up, their income would go up, their educational opportunities for their children would go up, as well as their employment. And so after that report, it set our city, as you can imagine, in our county, everybody was all up in arms about this report and what it meant. And this wasn't any new information for those of us who worked in the health department or had been talking about infant mortality, the rates of maternal mortality for years. But it was a big deal to those who weren't participating in our community meetings, who were not familiar, didn't use the website. And that's why I just want to be reminded that we're not the only people, if we're folks who work in organizations or government, that are missing this important information. It's important that we get the information out, but we can't take for granted that there's still so many people that don't know that these problems are happening. We tend to talk to those who already agree with us. And it's really important that we try to connect with those who don't know what we already know. And so it also helped us to convene and get together. But there were a group of, led by our Healthy Start CEO locally, convened about 75 Black women researchers, attorneys, public health professionals, and other advocacy groups to actually make a formal response to that report that really concluded that there's Black women in the future. Like, none of this research, none of this information, none of this, the studies or the reports that are happening include Black women or Black women's issues in their work. And so also out of that work came the Racism is a Public Health Issue announcement from the city, the mayor's office recently after the report was released, to really address some of the issues that were happening. We didn't find that there were any public health or any other governmental organizations involved. And so it was really critical that we got as many folks involved and engaged in this process as possible, which it ended up that they had over 200 Black women convene on the city steps just weeks before the decision was made. And there were petitions signed and information went around our community to actually it ended up being about 1,300 signatures. And one of our local partners, an epidemiologist at the University of Pittsburgh Graduate School of Public Health, actually was able to serve on the panel to really address some of the issues that we found were happening in the maternal and child health space. And so we were really excited that she was on our committee the whole time. She's reviewing the data. She's been an advocate for the work that we've been doing, and she was able to provide a response for that. And that was voted in. of course. And so a couple of months later, maybe a year later, our Allegheny County department also declared racism as a public health issue in our region. Now, what that means is still yet to be defined, because there's all these steps that have to come in terms of community engagement. And that's really the work of working with our partners, such as organizations like Roses or in your local community. Who are those key players that really can help you get the message out to communities? And how do we help communities get that response back into government so that it is reviewed in a way? And I understand the challenges and the bureaucracy, but I think we really do a better job if we get the feedback and help to streamline the process so it's easier for communities and community organizations on the other side. So that's a lot of our work, is helping organizations that already exist, that may not have had a voice, get their issues and their challenges amplified to a higher level. And so one of the things that came out of really thinking about racism as a public health issue is really thinking about organizations that spawn from that. And one of our local organizations, the Black Women's Policy Agenda, formed and became mighty out of this particular, these declarations, but also out of that report. And so in our community, you will see right now that there's millions of dollars being dedicated to various organizations to find ways to address racial equity. So if you have any ability to influence your city or county government, I think the racism as a public health issue is a good tool, because it's recognizable by all of your legislatures, regardless of their political stance, and it helps to give some policy background to the work that you're trying to do. And so I do think it was meaningful. I think the report was meaningful. I can obviously share the report with others, that if we can get the more data. And so I think when we say quantitative and qualitative data, it's key. It's essential to us really getting the message across. And it has to be more than just the data that's available to us. We have to do data sharing. We have to get better sets of data across systems so that we understand the things that are happening and the disparities that exist across multiple sectors of our work. And we're able to understand that these are not individual behaviors, and we're not going to educate people into changing. We need to change systems so that they're more accessible to people, and then the change will actually occur with both things happening, both systems changing and people having better opportunities to change. And so neighborhood investment, we've done a lot of work around the community leadership and neighborhood investment, including making sure we invest in organizations and communities that are doing the work. And that money, again, comes from private funding and also from some of our own state grants that really allow us to be flexible in deciding what we need, what are our needs for our community, and we're the right ones to do it, right? We understand what's happening on the local level, and how do we really make an impact with our partnerships is by investing in the people whom we're working with. We also have a community health advocate program that we started in partnership with our local Healthy Start project, that really it started with just trying to make sure that community members that we were bringing to the table had the appropriate information to feel like they can meaningfully be engaged, whether that was public health information, giving them the data about infant mortality and how that impacts the community, and also preparing a cadre of leaders to be available for the number of requests we were getting, increasing requests as a result of this report to talk to Black women about their experiences, for focus groups, for surveys. They were being asked to be on advisory boards, but many were not prepared. And so our community health advocate program was really a way to really build up individuals who wanted to be involved, but really just needed more information, the time and the space to work together and build their own efficacy around what they knew, what they understood, and how they could share that with others in the community. And we also gave them a stipend and a netbook so they would be able to have access to the internet so they could participate, whether that is in meetings virtually or to do their own research and figure out what's going on in their community outside of the information that was presented in the training. So those are things that we've been investing in terms of making sure community can be involved and engaged. Some of these things are happening in the health department. Some of these things are just happening in other organizations whom we partner with that we've provided the resources to do so. And then also, I think a thing that I'll leave with is thinking about what does leadership look like in your community? And for us, typically all of the community groups that we lead are facilitated by health department staff. One of the things that we learned through our equity assessment is that shared leadership means that we have to give up some of the ownership of the work. And so we actually had community residents leading some of our community groups, which we just provided the technical support, right? We sent the emails, we made sure people knew when to show up, but the facilitation actually was led by the community residents. And we saw a large difference in how our communities, our actual meetings started to operate. I feel like people felt more at ease, both professionals and community residents, once community members were in the leading role. It made the meetings a lot more, people felt more comfortable sharing, that they led through a very trauma-informed care process and approach to discussing issues that were very sensitive. But people, when we're professionalized, we forget that these are lives that we're talking about sometimes, and we get over professional. And our community members really taught us how to tap into our own feelings about a lot of the decisions that were being made, and really helping us to think more broadly about the issues that were happening and how it centered and impacted individual lives. Of course, I don't have to go into data. I'm a health department, and if others on the call are from government, we have access to loads of data, but it's important that we use the data and make it accessible to community. I think a lot of our data and reports, a lot of charts and graphs and but so what is what often community would say to us. And so we had to learn to kind of, how do we distill this information so it's valuable and makes sense to the everyday user and they can act upon it immediately. And so here's a couple of examples of some of the things that we do at our health department on our website that make things more accessible for community, both organizations and individual members of our community, to get that information out. And the asset mapping is just always understanding what our flow is in our community, who's doing MCH work, who's doing work in any particular area. And we do surveys regularly, try to figure out and make sure that we know what's going on. So those are some of the things that I can think about. That I'm gonna stop here because we're running out of time, I think. Lynn, is that correct?
Yes, we've got about 7 minutes.
And so I don't know if folks have questions or think about some of this work that I just talked about.
Yes, so there were some questions that came in, but first, Dannai, thank you so much for sharing about Allegheny's experience in basically flipping the script on how you engage community, how you very intentionally center that community experience, and like the conference, and engaging doulas and community health workers and that sort of thing, as opposed to the white coats, the academicians and stuff that we typically see at a conference. And that's deeply meaningful and really challenges that narrative of like what is considered expertise, who are the experts, right? And then tying that back into like your community and what data you're collecting, how you're interpreting that data. Everything that you're doing is so intentional about community and elevating community and centering community. And so I really appreciate you sharing. There were several questions that came in, and I think, how do I? So we're gonna go with. You can stop sharing. You can keep sharing. It is up to you. I'm sure people are benefiting from your frameworks. But there was one question, though. There were several, but there is one question that I think is relevant to a lot of people on the call. And Rose, feel free to answer this too as a CBO. But there is one question that asks about if you have any suggestions on if work is already being done but needs to pivot to better reflect the needs of the community without offending those who are already doing the work. And so I think your presentations kind of touched on that, but if you want to give that a little bit more room to breathe, please feel free to comment on that.
So in St. Louis, there were other organizations working in community as well. And some are doing it really, really well, and some are just, checking a box. And what we do is just be authentic in our engagement and partner as much as we can to with all the other organizations that are doing this work. It's hard to, I think sometimes folks are like, wait, I hadn't even thought about that, just because they hadn't even thought about that. And then they partner with you and now they're thinking about that. So I think, I don't know if this is internal, where you're saying folks are already engaged in community and you think they need to pivot or shift, because that's going to be a little bit more difficult, I think. But if it's external organizations doing it, I think there's enough community. None of us are servicing the entire community. We have, even if you have 200 people, there's still 2,000 people that you haven't touched, right? So there's enough folks to engage in community with.
Thank you, Ms. Rose. And Dannai, there was a question specifically about the tool that you used for your internal audit. Was that GARE? Or
No, we actually use CURE, is the name of the organization, the Center for Urban Racial Equity. But I can send the organization to you, Lynn, to follow up with the presentation afterwards.
yes, that would be great. I'm sure people would appreciate that. And let's see. Okay, so here's kind of a doozy of a question. With there being so many systems to undo racism, which system are you focusing on first? And who are the leaders, agencies, and other partners assisting you?
So for this particular issue, I think we're starting with maternal and child health types of organizations and institutions that can have an impact on infant mortality. Now, while that system is broad, we broke out into working groups. And so the illustration that you see on the screen is really the work that's come out of the CityMatCH project that we're currently participating in. I think Flourish participated, they're like one of our mentors in this work. And so this is how we kind of split the work up into working groups. So if it's a housing thing that families or communities think is the most important, in this example here was a walking path in one of the communities here locally in Allegheny County. And it was really out of thinking about health, do people have safe places to walk in their own community, and working with partners is exciting. Or you didn't think but WQED, where Sesame Street kind of was filmed and Mr. Rogers was filmed, is partnering with community residents to build that walking path out, to make it beautiful. The city of Wilkinsburg is changing and making sure to repair the streets and the sidewalks so that they are accessible for individuals who may need to use car seats or any other type of wheel accessibility. And so there's all different organizations and partners that could be a part of it, but I think it depends on the work. And I think each time you think of a new way to address the need, then there might be new partners you have to engage. So that's ever changing with us, depending on the thing that we want to see change or our goals.
And I think a follow-up to that from the same person is, does it entail police departments, Department of Transportation, and public health? Yeah. Thank you, Ms. Dannai. How is the work engaging fathers?
This is definitely an area of growth for us. We actually have men who are on the community leaders cabinet. As you saw, one was represented in the slide that I shared, but we've been more intentional in recruiting some more men in those high impact zip codes as well. And we just began partnering with I'm blanking. He's a new doctor, African-American doctor in the St. Louis area. He's connected to Washington University, and he is running a father's support program out of the ICU. So for those babies who are struggling, so that there's support for fathers in this. We always think about the mom, we always think about the baby, but sometimes we don't think about the father. And so we're trying to figure out ways to integrate him into our Flourish work as well, because that's such a needed area. Yeah, definitely need dads.
And I do deliver services out of our office here at the health department. So we do have fatherhood programs and services here, father and partner, because it's really about family members. Any other male influence in the child's life is eligible to participate in the programs. And we use evidence-based programs through the National Fatherhood Initiative.
Thank you both so much for answering our questions. So we are at 31 past the hour, and I want to honor your time, but we have most of the attendees still on, even though we're over time technically. And so I think that indicates a lot of interest and value in what you have to say about your experience in equity work, in engaging communities, and in reducing health disparities and improving health outcomes for maternal and child health populations. So thank you both so much for your time this afternoon and for all of the work that you do, that you continue to do, and yet your deep commitment to your communities. And for everyone still in the audience, this was recorded. I will share the resources, the slides, everything that both of our lovely presenters have shared with us today in a follow-up email in the next week or so. But again, thank you, Ms. Rose, Ms. Dannai, for your time today. We really, really appreciate you both.
Thank you for the invitation.
Agreed, thank you.
All right, everyone. Thank you for joining us. Have a great afternoon.